Good evening, everybody. We are almost at the end of our campaign, and so we are so glad for those of you who have been here consistently and who are here this evening. And even though the weather is turning out to be strange, we want to thank you so much for coming. Tonight, we are at the solution to my pain. And tonight I'm going to talk about what a lot of us suffer from, high blood pressure. So, what are the main causes of high blood pressure? Normally, we are told that cholesterol is the main thing, but actually cholesterol is a good thing. It plays a very big role because it acts as an anti-inflammatory in your carotid system, actually. So that means whenever there is pain or injury or anything like that, the cholesterol rushes to the area. And so you have your HDL, which is your high density lipoprotein, and that basically flows in the middle of your artery. So your artery walls, and then the blood flows in the middle. So your HDL flows in the middle, and this carries your proteins and your excess cholesterol to the liver, and it stores it. Then you have your LDL, which is your low density lipoprotein, and this one actually you find it on the walls of the artery. So it repairs and rebuilds when there is damage, and it takes the cholesterol and the glucose to the brain, and our brain mainly functions off cholesterol and glucose. So when there's damage in the area, and what causes damage to the area are environmental stresses. Environmental stresses are things like smoking, alcohol, toxic fumes, chemical fumes, things that you breathe in, malnutrition, not getting enough rest. And so it's basically things that we do on a day-to-day basis that impacts and causes these environmental stresses. So what happens in the arteries is that as we are not sleeping, stressing, breathing in all these toxic fumes, having high levels of stress and all of that, it then breaks on the inside of our arteries. So it forms like little chips. It's chipping away on the inside all the time. So then your LDL comes and it builds and repairs whatever was broken or chipped. Now over time, this causes scar tissue, and the scar tissue builds up the more we have environmental stress. So when the HDL brings the glucose and the proteins and nutrients and all the stuff in the blood through the middle of the artery, because the scar tissue on the sides of the walls is now protruding inward, and it's now causing the walls to become rigid and hard and dense, and it starts narrowing. And over time that narrowing gets smaller and smaller, the artery wall gets harder and harder, the more stress, environmental stress we have. So now the proteins and the glucose is coming with the HDL through the bloodstream, and then it gets stuck in these rivets, that is scar tissue that has built up. And with the result that if there's just one molecule that maybe gets stuck in between the two, that's when you get heart attack or when you get a stroke, depending on where it lands. So the narrowing of our artery walls is what causes the pressure buildup, and that's where we get high blood pressure. So it links back to what we eat, because malnutrition, lack of sleep, lots of stress, those types of things are causes, direct causes as to why we have high blood pressure. Then the second thing is that our heart constricts and relaxes. So it does this pumping action all the time. And it needs two minerals for that. It needs calcium to constrict it, and it needs magnesium to relax it. So that we get from the food we eat. So once again, if we don't have enough food with enough nutrients in, and our body can't make the proper calcium, like I spoke about the other night, we don't need the calcium from milk, we need the calcium from what our body makes from the beta carotene and the vitamin A. So if our body is not having enough calcium, it's going to have problems with constricting. And if we don't have enough magnesium, which we also get directly from our diet, then it's going to stay constricted and it can't relax. So if you tramp on a hose pipe, right, you're putting pressure on it, so it's constricted. So if your blood vessels are in that state all the time, it's going to build up pressure. And that is also how high blood pressure starts. So once again, everything filters back to nutrition and your diet. So you need to also try to take Himalayan salt because it has all the nutrients and the minerals that our body needs to make the magnesium, to make the calcium, for the cholesterol and all of those processes that we need. We have to get it from the salt and the food that we eat. Thank you.